Mr. Munsami, good afternoon to you and welcome. So your sense is that stigma is on the rise in the workplace. How does it manifest itself?
Stigma usually is manifesting itself through people wanting to not engage and interact with people the way they would have in the workspace previously before COVID. We're also seeing a lot of information being passed around within organizations in terms of sanitizing and in terms of social distancing, but not many organizations have been addressing the associated stigmas that come with this virus of late. And we've been experiencing it in the learning and development landscape.
So critical then within the workplace that the narrative or the conversation is changed. How do you do that?
Now, it's very important. I'm seeing that organizations, particularly within the ones that we've been working with the NQF1 hygiene and cleaning programs we're doing, they are now communicating a lot of information to their people via email, via notice boards. You'll see displayed at elevators as an example. We're seeing information, but now we need to be shifting the focus as well to incorporate and include the stigma approach. We're seeing people are more reluctant to come forward and talk about mild symptoms or talking about maybe if they're having a cough or a sneeze. And this, unfortunately, does nothing for cohesiveness within a business. Remember, within organizations, we still have to be cohesive. We still have to communicate. We still have to service the customer. And if we're going to have some level of discrimination amongst the people within the business, then this unfortunately doesn't speak to a cohesive, well-functioning department.
Are they worried about being ostracized? Are they worried about retribution in the workplace? Or is it a combination of both of them?
I would say a combination of both. There are examples that I could use, and why I became so interested in the subject is learners of ours who within the first week, just recently I became alerted. So learners of ours have been coming into the training forum, and with their facilitators, which led us to do the poll amongst our students, was how open are they to communicating about this virus, whether they've got COVID or not, or whether a family member. And an alarming number of them said that they weren't comfortable enough to speak about it for fear of some level of discrimination or some level of anxiety or causing levels of anxiety. And we need to understand that a lot of these people are going to work at the moment to work with other people because, money is needed. People, it's desperate times. So you're faced with a dilemma, really. One learner had to even relocate from the area that she lives in because she had not tested positive, but it became general knowledge that she went for a test. It turned out that it was negative, but her immediate community didn't welcome her back.
So just finally then, what would your recommendation be in dealing with perpetrators? Do you punish them? Do you sanction them? Or is there a different approach?
Now, organizations would have had to amend their policies. And in doing so, I'm going to encourage other organizations to have a very open, honest conversation with the rest of the business. This needs to cascade from the top down. So if our executives and our CEOs are now preaching as far as the stigma is concerned, as well as social distancing, wearing masks, which we know is a massive preventative measure, all of this cluster of information needs to be communicated within the organization, and then we thus start to desensitize. The minute we don't talk about it, it becomes a taboo.
Thank you for joining us. Devin Munsami, Chief Executive Officer of the ICHAF Training Institute.